Hello to everyone, and in this video we'll be discussing on the etiology and the pathogenesis of the pathology called as the pulmonary embolism. So we'll be discussing first of all with the definition. So pulmonary embolism is a form of venous thromboembolism. So this embolism actually develops from the veins, okay, and this condition develops due to the presence of embolus meaning is simply a blood clot which will be present inside the vein and which will be moving from veins to the other vessels, like it can go from lower extremities veins to the pulmonary vessels, and that emboli will lead to the pathological name called as pulmonary embolism. And this blood clot restricts the blood flow through the pulmonary artery or its branch. Okay, so this blood clot will be restricting the blood flow to the lungs by blocking the blood circulation. Now, where is the embolus formed? This disease is typically for the patients over 40 years who suffer from obesity and varicose veins of the lower extremities. Okay, so these are the two conditions with the patients who are suffering the overweight and the varicose veins. Okay, so these varicose veins are actually seen in the legs or the lower extremities veins. Okay, so they will be dilated or they will be seen superficially. You can see on your extremities on the posterior side of your legs. Okay, on knee. Now risk increases with the patient with positive family history, that is a genetic factor. So there is risk with the positive factor and occurs in 1 or 2 out of 1000 people per year. Okay, and it is manifested by blood clots in the deep veins of the lower extremities, as I told you. So it is actually seen first of all in the deep veins of the lower extremities, and then it progresses forward to the pulmonary vessels, and frequency increases 3 times more commonly in people over 65 years of age than in patients with 45 to 55 years of age. And this occurs in the older age due to decrease in the protein C and S, because they are actually anticoagulant system. Okay, so if there is any clotting, so they will remove that clotting, this proteins. So in the age that, like over patients who are over 65 years of age, in those patients this protein C levels and protein S levels decreases, and because of that the functioning of the anticoagulant system decreases. Now the connection between the venous thromboembolism and the pulmonary embolism is that the embolus enters the vessel of the lungs from the deep vein of the lower extremities, as I told you. So this emboli will be actually first of all formed in the lower extremities, that is in your legs or deep veins of your legs, and then it will move forward towards the pulmonary vessels, and after reaching the pulmonary vessel, this venous thromboembolism will be named as pulmonary embolism. Okay, so origination is actually from the lower extremities. So in this you can see mechanism, you can see it here. These are your lungs, and cutaway view of this is a cut part of the vessel from here, and blood clots circulating in the right and the left pulmonary arteries. You can see this red parts in the vessels, right and left pulmonary arteries, and these clots are restricting blood flow to the lungs also, and because of that there is impaired circulation in the heart also. Okay, you can see it here. So you can see this emboli damaging. Here you can see in this vessel there is embolus. Clear? So this you can see in the patient, embolism in the pulmonary vessels. Now what conditions contribute to development of pulmonary embolism? First factor is congenital and acquired thrombophilia. There is a genetic factor, increased levels of estrogen in the blood, basically in females, and deficiency of blood coagulation inhibitors. So deficiency of blood coagulation inhibitor, like as I told you, protein C, protein S, these all are, if deficient, then a patient can develop pulmonary embolism, and case of the oncopathology, that is cancer. Now risk of thrombosis increases with dehydration, strong increase in the body temperature, sepsis, pressure on the veins, if there more pressure on the veins due to any type of tumor is there or any obstruction to the veins, so because of that there can be formation of thrombus there. Okay, and taking certain medications, so due to the side effects of the medication, this thrombosis can develop. Now pulmonary occurs as a result or after. So if the patient has prolonged immobilization, then there is chances of development of pulmonary embolism. If there is multiple injuries to the same area or injury to pelvic bone, specifically to the pelvic bone, there are chances of development of pulmonary embolism. Now patient is gone through surgery, so after surgery the patient can develop this pulmonary embolism, and prolonged catheterization of the vein. So catheter is placed inside the vein for the long duration. So after removing that, there are chances of development of pulmonary embolism. Now, all risk factors of pulmonary embolisms are related to the virtuous triad. This is a triad which is actually used for the embolus. So, in this case, we have three triad, that is 3 points. Now, violation of coagulation, that is the coagulation system will be violated. Body will not able to coagulate. Now, damage to the endothelium of the vessel. Endothelium of the vessel will damage, and pathology of blood circulation. So, these three triads you can see in this triangle: endothelial injury, hypercoagulability, venous stasis. Okay, so hypercoagulability meaning is that the more clotting means the clotting factors are increased, and due to that the clotting is more inside the blood. So the anticoagulant system is not working properly to thin the blood, like blood thinners we use for this patients as a treatment. I will tell you later. Okay, now this is called as hypercoagulation. Now, effect of genetic on the development of pulmonary embolism is factor 5 is Leiden factor, which is called as Leiden factor. Also, it is missing or deficiency is there. Mutation of the prothrombin gene in the patient, lack of antithrombin factor, deficiency of protein C and S, as I told you, and hyperhomocystinemia. So if there is a decrease in cysteine in the blood, then there can be the chances of development of pulmonary embolism. And after surgery, as I told you, risk of pulmonary embolism increases with oncopathologies or orthopedic surgeries. Now, patients who are going on with the surgeries of the cancers or surgery of the orthopedics, then they have the chances of development of pulmonary embolism. The surgery can also lead to long-term embolization and inflammation. So, patient on surgery have long immobilization. So, this is also a factor which can lead to pulmonary embolism. Now, secondary damage to tissues leads to the release of cytokines. So, after surgery, there may be some secondary damage to other tissues, and because of that, there can be release of cytokines there, and which will disrupt the natural destructions of blood clots. Now, cytokines actually inhibit your the destruction of the blood clots, and which reduces the level of activity of anticoagulant system. So, because of that, the anticoagulant system will be decreased, and because of that, it will be increase the blood clot formation in the blood. Okay, so this is the main factor. Now, prolonged embolization, as I told you, like joint fixation, the patient is having any fracture or somewhat, okay, and hospitalization for very long time and long journeys. Okay, so patient has a long journey on flight and somewhat, like study found traveling 10,000 kilometer on aeroplane had only 4.8% cases of pulmonary embolism per million. So there are cases who are traveling for very long duration, sitting for very long duration in the plane or flights, so they have the chances of developing this pulmonary embolism. Now, malignant neoplasm can be the also factor, like thromboembolism develops in the patient with cancer during the first year of the discovering cancer. So the patients who have developed cancer, they have chances of development of this embolism in the first year of their period of cancer. And active cancer, the patient who is on the active cancer therapy or suffering from cancer, they are on the major risk of pulmonary embolism. Now, estrogen use and pregnancy. Now, active use of oral contraceptives increases 3 to 4 times risk of pulmonary embolism. Okay, so the females who are on oral contraceptive, they have high risk of developing this. Now, pulmonary embolism and heart disease, what are the relations? The risk factors like smoking, hypertension, obesity increases the risk of pulmonary embolism. Now, risk factors can be of two types, like genetic and acquired. In acquired, we have provocative, like surgeries can provocate this factors, acquired factors, and then can lead to pulmonary embolism. Non-provocative factors like obesity or any autoimmune disease in the patients. Now, the smoking and hypertension are related to heart disease also. This pulmonary embolism can lead to cardiovascular pathologies, and these are the risk factors the patients who are suffering from, who are on the smoking, very frequent smoking, hypertension patients, obesity, these all are the risk factors. Now, pathogenesis is the of this pulmonary embolism, gas exchange disturbed, as a result of which hypoxemia develops, decrease in the O2 in the body, decrease in the oxygen level in the body, and load on the right ventricle increases because of that, and it needs for oxygen increases, and often there is right ventricular failure. So this pulmonary at last can lead to heart failure also as a complication. Clear? Now, what about prognosis? If we talk about prognosis, the life of the patient with this disease, so factors worsening the prognosis of pulmonary embolism, like cardiogenic shocks the patient who have, they will have a very worsening prognosis. Disturbance in the right ventricle if develops in this pathology, then there is also very bad prognosis. And damage to the heart muscles, if there is any damage to the heart muscle, then this patient suffering of pulmonary embolism has a very bad prognosis. Now, treatment, as I told you, blood thinners we can give to remove the clot or thin that clot formation in the blood. Now anticoagulant system we can give warfarin is there, warfarin in the form of comedin, and xantovin we can give, and heparin by IV administration. Clear? Now in this x-ray you can see, this is your chest x-ray, these are the pulmonary vessels, you can see flesh shine, you can see flesh in the on the x-ray we can see flesh shine. This is a specific name used for the x-ray, flesh shine, we can see it here. So this is the x-ray for the patients. And the symptoms, if you see the symptoms of pulmonary, like cough is there, coughing with blood, wheezing is there, dull chest pain, unexplained shortness of breath, and loss of consciousness. And treatment, as I told you, vitamin K antagonist for long term treatment we can give, and for the initial treatment we can give heparin, as I told you, and thrombolysis, percutaneous mechanical embolectomy can be done, that is surgery, and vitamin K antagonist can also be given in the initial treatment. And for long term treatment we have to give vitamin K antagonist. Thank you. So this was a video for pulmonary embolism. Thank you.